To put together a conference like today really requires a lot of planning. We start many months ahead of time, sometimes even a year. We work on everything from messaging to getting the right speakers and concept. Because when you have an important conference like this, you want to ensure that you have the people you want to have there. So you really need to identify these people, reach out to them, and also give them compelling messages to come. Why is this conference important?
I've been seriously impressed by today's policy conference. The thing that has most surprised me is not just the number of the people who've turned up, but the kinds of people who've turned up. We've had a broad representation from policy, politics, industry, practice, academia, patient council. Wonderful that we've got representation from the people who are actually having to live this. Today, I think, has brought a set of perspectives that is really unusual to see brought together at the same time.
I was very glad to see how the debate has evolved in the course of the past years, also thanks to the efforts of all these stakeholders in terms of putting the treatment of obesity in the agenda of policymakers. We used to have a debate only focused on primary prevention. We're now hearing experts and policymakers talk about obesity as a disease and recognize the importance of addressing it as such.
Well, my impression on today's conference, and having been at a previous one, so I've seen progress, and that progress I think is perhaps summed up by the can do, will do, should do issues. People were coming to this conference from member states, telling us what they were doing, not as perhaps as in the past what should be done and what needed to be done, but how they were meeting the challenges. And that's progress, that's real progress.
What we found was that, firstly, a lot of institutions were represented and engaged and committed. A lot of member states were involved and engaged and committed, and a whole host of new stakeholders participated, became involved in the discussion, and are now supporting the work of EASO and understand the importance of working together to tackle obesity. This conference today was one of the actions running up to European Obesity Day. The idea was to convince policymakers of the importance of obesity. So many countries are undertaking actions engaging the public, engaging patients, engaging policymakers, and importantly also engaging media. All of the countries that are engaged with EASO are engaged in European Obesity Day.
Cambre has organized European Obesity Day for the past 3 years. The main achievement so far has been the recognition of obesity. Today, when you go in Brussels and when you talk to policymakers, they have an understanding of this. They are interested in it. I mean, we see this policy conference we had today. We had the Commission there, we had members of Parliament, we had national members from the ministries. And this is new and this is very big, and people are coming together, and that's a big achievement. The Cambre healthcare team is unique because it is so many things, but most of all, it is a team. You have people that have a passion for healthcare. They want to make the life for the people and the European citizens better, and that's what makes us special.